A very good evening to everybody. We welcome you all to this very special session of Humanizing Lives in collaboration with KMC Hospital, Mangalore. KMC is a very successfully running renowned name in the line of medical sciences. We have with us some of the most esteemed doctors with decades of experience in their kitty to talk to you about breast cancer. Now, we all know that cancer has been one of the biggest evils that we have been encountering in the past couple of decades across the world. It could be the lifestyle changes. It could be absolutely your health, your body, biophysical composition that leads to the onset of this disease in individuals. Whatever be the reason, what still remains the fact related to this particular problem is that it's not only a medical condition that affects your body. It is a condition that is generated. The onset of cancer takes a long time. It's when you start taking your body for granted. It's when you start tiny small little signals that your body is giving that cancer seems to kind of find its scope and crawls into your life to show its dirty, scary face. But today, when we talk about breast cancer, a particular kind of cancer which exclusively targets women. When we talk about breast cancer, it becomes then important for us to not only talk about the science behind breast cancer, not only talk about the physiological aspect of breast cancer, the reasons why it starts. Of course, it's important, and we would be extensively covering that. But I'm sure if you are somebody who is conscious about the state of your body, you've already attended many webinars and talks that talks about the generic understanding of the various kinds of cancers and breast cancers. Lives, a wholesome healing is a target. That is the stage we try to reach. So we have doctors here with us who are going to discuss with you today about the physiological aspect of breast cancer. They're going to be talking about the kind of medical procedures to cure or to stop the growth of this cancer in your body. They're going to be talking about the reasons that leads to this cancer or the things that you can do to avoid it. And then we also have two very special people who look at a more everyday life trauma related issues that come with cancer, come as a gift with the cancer. So on one hand, you are physically battling with it. On the other hand, you're not only going through a lot of physical pain, but you're also going through a lot of trauma in your life, in your social life. People start looking at you a certain way. People start reacting around you a certain way. One end of the process of physical healing is then also encountered with the social reactions around. That ends up having a very deep mental impact in your life. Affects your mental happiness, mental peace, mental well-being. As it is, you needed all the strength in your bad body to recover from the impact of cancer, and you also have the mental illness taking over you as a onset after effect of the trauma that you go through. We also have with us a psychologist who's going to be talking about the psychological aspect of this problem. And how is it that a caregiver can assist the patient? How is it that the patient can work on herself to come out as a much stronger, evolved personality? Then we also have with us a person who talks about what you put into your body on everyday basis. What is it that you can include in your everyday diet that is going to help you keep your body healthy, keep your mind absolutely happy? You are made up of what you eat and what you think. So those are two aspects we are going to be covering. We have on board with us a very, very esteemed team of doctors. We have Dr. Harish E., who is currently working with KMC. He is an MBBS doctor. He's a general surgeon, and he specializes in surgery in oncology. He has been working for the longest time in the field of surgery, and he brings on table here with us the technicalities of the surgical part. Then we have a senior dietitian from Manipal Health Enterprises again. She has 16 years of experience as a dietitian. She is also a member of Indian Dietitian Association. We have all of these doctors here with us. I'm sure you'll find it exciting. Then we have Dr. Vidyashri Kamath. She is a consultant, she's a gynecologist, and she also specializes in laparoscopic surgery, obstetric care, minimal invasive surgeries and infertility. She is somebody who specializes in women reproductive health and things related to it. We have with us Hiba Siddiqui. She's a senior psycho-oncologist in Max Cancer Care Institute and Healthcare. Max Healthcare. We have a team of four very, very esteemed experts who are going to be talking about their specific fields here. Dr. Aruna Malaya will be talking extensively only about your eating habits, things that you can bring into your diet before and after the experience of the disease, or also for the people who can maybe make smaller changes into their diet to avoid the onset of this disease. Now, opening up the session here, I would like to, it's important first to get introduced to a particular problem. Therefore, I would be bringing on board Dr. Vidyashri Kamath. A very warm welcome, ma'am. We welcome the audiences here. We welcome Ms. Hiba, we welcome Dr. Aruna, and we also welcome Dr. Harish. A very, very warm welcome to the session today. Thank you so much for accepting our invitation and being gracious enough to devote your time to this cause during these very, very difficult times. These are very, very odd times. We're all kind of struggling to grapple with the change that our life has gone through. Thank you for attempting to, in that sense, assist the people who are struggling with this additional issue in everyday life. Welcome you aboard today. And with that, I would bring our first speaker on, Dr. Vidyashri Kamath. Dr. Kamath, you have had a large experience of expertise in various kinds of fields related to women physiological issues and details. You talk about menstrual health, menopausal disorders management. You talk about family planning. You must have dealt with variety of women in your career so far. So you definitely understand the kind of struggles, the kind of mindsets, the kind of laid back attitude women approach life with in their personal well-being and health care. Ma'am, I would like you to please start the session and tell us a little about breast cancer and the kind of incidents and details that you may have had to experience in your experience so far as a doctor dealing with women's health particularly. Over to you, Vidyashri.
Hello. Sorry, ma'am, you are mute. Hello.
Okay.
Yeah, we can hear you.
You can hear me now?
Yes, ma'am.
Okay. So, good evening, viewers. I'm going to talk about screening for breast cancer. Now, let us know how big is the problem. Breast cancer is the #1 cancer among Indian women, with a rate as high as 25 per 1 lakh women, and out of which 50% of them die. This is the 2018 statistics. So the survival rate is around 66% in our country as compared to the US and Australia, where it is around 90%. Now, this stark difference is because of better awareness, better screening programs, and also accessibility to healthcare in the West. Next slide, please. Next slide, please. Yeah, no. So why is awareness important in breast cancer? Is because it's one of the most widely prevalent cancer, a cancer with a high mortality, and it has very good screening tests available for early detection. And if detected early, then treatment can be given, which has very good treatment options available. And when good treatment is given, it results in less cancer deaths. So that is the need of the hour to create a health awareness program in a country like ours. Next slide. Now, coming to the risk factors, being a woman itself is a risk factor. Having said that, even men are at a risk. So if you see 100 people with breast cancer, one is a man in that. So, but majority of them are women. Having a breast itself is one of the most important risk factor. And growing older increases the women to a little slightly higher risk, especially more than 55 years of age. Next slide. Next slide. No, previous slide. Previous slide. Yeah. So the other risk factors that we see is, it is seen in 5 to 10% of the women who have an abnormal gene. All of you might have heard about Angelina Jolie, who had the faulty BRCA1 gene in her, and she glamorized about the breast cancer, and a lot of awareness came in with her standing as an ambassador for it. So BRCA1 gene mutation can cause high possibility of breast and ovarian cancer, as high as 80% in women. They are prone for breast cancer, and almost 60% of them are prone for ovarian cancer. And these cancer happen in young women, and it's more aggressive. That is why it's important to look for family history of breast, ovarian cancer, and also pancreatic cancer, especially in the first degree relatives. That is mother, sister, or a maternal aunt or a paternal side, anybody close relatives having cancer in the family like breast, ovarian, pancreatic, or prostate, then they are at a higher risk. And now with modernization and with women empowerment, women are planning to get married a little later, and they plan childbearing well into their mid and late 30s. Now that again exposes their breast to high levels of estrogen and progesterone for quite a bit of time, for a long period of time. So also early menstruation and late menopause. That is, if a girl starts her periods well before 12 years of age and goes on to have menopause beyond 55, then these women are at a higher risk. Being overweight, obesity, and diabetes again is a risk factor. Prolonged use of oral contraceptives. Now, the birth control pills, if you use it for a prolonged period of time, say for more than 5 to 7 years, and there are specific formulations, there are certain drugs that incriminate for a slightly higher risk for them developing breast cancer. In the same way, hormone replacement therapy after menopause, especially if it's taken beyond 60 years of age and for more than 5 years, then there is a slightly higher risk. Consumption of alcohol and tobacco again puts them at a higher risk. And breastfeeding is supposed to be protective. So if normally we tell our women to breastfeed their babies for at least 1 to 1.5 years. So if they don't do it, if they don't breastfeed enough, then they are at a slightly higher risk of developing breast cancer. Next slide. So early detection saves lives. That is why it is important to screen for breast cancer. Now, Next slide. Next slide, please. Now, the benefits of breast screening is that it detects breast cancer in the early stages, and the chance of successful treatment is very high. And when diagnosed in early stages, there is almost 90% survival. So women can get cured of the disease. So that is the importance of screening for breast cancer. Next slide. Now, how do we screen our women? Is by the previous slide, yeah, is by breast self-examination, where the woman herself examines her breast and looks for any changes in the way it looks or feels. Or it could be a clinical breast examination when the expert does it. It could be a gynecologist or an oncologist or any primary healthcare provider. And imaging modalities like mammogram, which is nothing but an X-ray of the chest, of the breast, which picks up abnormal lesions and suspicious lesions. And rarely MRI is done, especially in high-risk individuals. So next slide. So you hear a lot of media stories and internet posts about being breast aware. Now, what is that? That just means that you know what is normal for you. You know how your breast looks and feels like, know what changes to look for, and to see the doctor if there are any unusual changes. Now, what one has to look for is a change in the size, shape, or feel of the breast, a new lump or thickening in the breast or axilla, skin changes such as puckering, dimpling, rash, or redness in the skin, any fluid leak from the nipple in a woman who is not pregnant or breastfeeding, and that fluid could be as watery or serous, or sometimes it could be bloodstained as well. Now, normally the nipple is protruded, but if it is retracted, then that could be a problem, or any pain in the breast. Now, these are the next slide. Yeah. Here you can see that definitely there is an abnormality in the way the breast looks, and there's a lot of discharge. There is puckering of the skin. There is a blood-stained discharge. There is the skin over the swelling. The breast is shiny. So these are all abnormal changes where one has to report to the doctor when one finds one. But one has to know that it doesn't necessarily mean cancer. There are certain benign conditions also in this. So one has to report to a doctor if they find some kind of abnormality in their breast, because most of the times it isn't cancer. So coming to the breast self-examination, when do we do it? It is ideally done after the periods, because that is the time the breast is more soft and supple and there is no pain. And you do it in two ways. First is the inspection, where where the woman stands in front of the mirror and looks at the breast, looks at and sees if there's any size of the breast, the discharge, any skin retraction or retraction of the nipples, any dimples. You would do it in sitting position or leaning forward or even lying down. And the three fingers, that is the index, middle, and the ring finger, the pad of the fingers are taken and palpated. The against the breast tissue is palpated against the chest wall, and to look for any lump or node or any abnormalities that one would look for. And it generally has to be, the whole of the breast has to be examined. It could either be from the areola to outside in concentric circles, or in a radial approach, or vertical or horizontal stripes. The whole of the breast should be examined, including the armpits. And sometimes it's always better to do it under a shower, where you can, with the skin is more wet and slippery, and you can nicely glide your fingers over the lump and you can detect it better. So coming to the imaging modality, mammography is a very cost-effective, imaging modality that one has with very good pickup rates. Now, what is this? It's nothing but a specialized X-ray of the breast, where the breast is compressed between the two plates. Sometimes it could be uncomfortable to many women. And then X-rays are taken. So this is a normal looking X-ray. Now coming to the screening guidelines, when is it that the woman has to undergo mammogram? Is that normally beyond the age of 20 years, we encourage our women to do the breast self-examination, and then the clinical breast examination has to be done at least once in 3 years up to the age of 40. By 40, the treating doctor could talk about the screening method and encourage them to do it. But by the age of 45, yearly mammograms are advised up to the year of 54 years. And beyond 55, it has to be done once in 2 years till as long as they are in good health. MRI, as I already told, it is slightly expensive. It uses the magnetic waves, and it is not routinely used. It's only used for women who are at a high risk, who have abnormal gene, who have hereditary cancers in their family. And it is done quite early on in their life, as young as 20s or 30, because these cancers manifest as early as 30s or early 40s. So to conclude, I would say early detection is the best protection against breast cancer. One should be aware of how her breast looks and feels, and to report any abnormal changes if one finds, and also to go for mammography beyond 45 years, because early detection is the key for improved survival and better favorable outcomes. Thank you all.
Thank you very much, ma'am. I think it was a very, very, very informative slide and presentation, at least for a person like me who probably hasn't had a family history of cancers as such, but lifestyle, which is, every other woman's, urban woman's reality today. The work takes over life, the medical complications only kind of become an attention aspect of life when we have extremely visible symptoms. Uh, Otherwise, it's the race for career, it's the race for life that takes over. So thank you so much for letting people like me know that these are the things that we can do to ensure that we are physically well taken care of as well by the medical sciences today. Moving on, I would now like to invite our next guest, and in the meantime I would also request our audiences, the listeners here on board, to please keep writing your questions to me in the chat box. The chat box is open to you. Please write your questions. I would be directing the questions to the doctors as and when the session ends. Towards the end of the session, we would be having a very, very detailed discussion. So any doubt, any curiosity that you have should be brought through the questions to gain more clarity, and we will do that in the end of the session, and we will wait for your questions. If you name the doctor specifically that you would want to ask that question to, it'll be great. Moving on to the next presenter here with us today is Dr. Harish E. Dr. Harish also works with KMC Hospital. Dr. Harish has a MBBS, MS, and MCH degree. He's a surgeon. He specializes in oncology-related surgeries, and has again had over almost better part of experience to his kitty. I welcome you today, sir, to the session. Um, he's going to be talking about what happens once you have been detected with the cancer, what it is that the medical sciences does to relieve your pain, to recover. A very, very warm welcome once again, doctor. With that, I request
no problems. Hello. Yeah, good evening, audience, and good evening, all the panelists here. Okay. As Dr. Vidyashree has already discussed with you all the signs, symptoms, and regarding screening and the causes of breast cancer, what are the risk factors of breast cancer. So we should all first aware that the most important thing that the awareness which we have to spread here is the early detection. So whenever we detect this cancer early, we are able to cure it so that we can prevent the death because of this breast cancer. So the mortality can be brought down. That is the most important message that everyone has to get. And this regarding this breast cancer mortality, which because of the awareness that they have brought down in many countries all over the world, especially in developed countries, USA and European countries, they are doing this breast cancer awareness on this particular October month, and they are able to bring down the mortality because of breast cancer. So it is an, as ma'am told, it is the most common cancer all over the world, and it is in women especially, and it is the common cancer even in India, and it is possible to detect this cancer in early stages with very simple tests available, and also possible to cure, treat this well and cure this disease with all the treatment options available with us. So the most important thing here is to detect it early. So whenever some patient finds these symptoms, signs and symptoms, that is either a lump in the breast or discharge or an ulcer or change in symmetry of the breast compared to the opposite side, the patient has to visit the oncologist as early as possible. So they examine the patient, that is called clinical examination. So why I am mentioning here is, it is not the self-examination of the breast which is important. It is the clinical examination of the breast which is more important. When an oncologist examines, because all lumps are not cancerous, only an oncologist who is an expert can identify this lump and can do further testing, that is an imaging, that is an mammogram or an MRI or an ultrasound, depending on the age of the patient. Especially a woman who is more than 40 years, we generally do a mammogram. If the woman is younger, where they have dense breasts, and a woman who is having a strong family history, then we are going to do MRI. So after clinical examination, we are going to do imaging, that is a mammogram or an MRI. After MRI, we are going to do a biopsy. So the biopsy may be either FNAC or a true cut biopsy. So with these three simple steps, that is examination by the doctor, and by imaging, that is a mammogram, and a biopsy, that is an FNAC. With these three simple steps, we are able to diagnose breast cancer. So it takes not more than 30 minutes to do this, and within one day you are going to get the biopsy report, and you are able to identify whether the patient is having breast cancer or not. Once you diagnose this breast cancer, the next important step is to stage the disease. Though the staging in breast cancer has four different stages. The earliest, what we call stage 1 and stage 2 are early stages, and stage 3 is locally advanced stage, and stage 4 is metastatic disease. So once the patient reaches stage 4, that is when the cancer has spread to other parts of the body, either lungs or bones or the liver, then we are not able to cure the disease. So it is very important to identify disease in either stage 1 or stage 2, or at least in stage 3. So when a patient is diagnosed in either stage 1 or stage 2, there are different options of treatment options available. That is, either we can go with surgery or chemotherapy, or the other therapies like hormonal therapy, targeted therapy, and radiation therapy. All these, there are 5 different options of treatment available for breast cancer. Whenever a patient is diagnosed in early stage, we go ahead with surgery first. That is, we can remove the tumor along with some tissue. No need to remove the complete breast if it is in the early stage. So we can, that is called breast conservation surgery. So we can do this surgery, or we can, in some patients, we can remove the whole breast, that is called mastectomy, depending on the MRI or the mammogram imaging. If it is multicentric disease, we cannot do breast conservation in those patients. There we can remove the whole breast. So that is where we are doing mastectomy. So once we do surgery, we see the report that is called histopathology report, and then we can consider the patient for either chemotherapy or hormonal therapy. Chemotherapy can be different chemotherapy regimens. Hormonal therapy is considered in patients who are ER/PR, that is estrogen receptor or progesterone receptor positives. And if the patient is HER2 new, that is a receptor gene, that if it is there is a therapy called targeted therapy. If HER2 new is positive, then we are going to give trastuzumab, that is another drug. There are new drugs in this targeted therapy like pertuzumab, olaparib. So these drugs can also be considered. So most important thing for us to understand here is whenever in all the three stages, that is stage 1, stage 2 and stage 3, surgery is required. Surgery is must to cure the disease. The other therapies what we are giving, like chemotherapy, radiotherapy and hormonal therapy, all these things are called adjuvant therapies, that is to avoid recurrence in a patient. So so many patients who visit my clinic, they ask these questions, sir, as I told, in India, what the surgery we are doing is 70% of the patients undergo total mastectomy, that is we are removing complete breast, compared to Western countries where only 70% of the patients go breast conservation, where we are preserving breast. The main reason here is the lack of awareness. What many patients ask me is, sir, if you remove the whole breast, is it safer than removing just a lump? That is not so. It is possible to do equally safe surgery even by preserving the breast. So when we can also use other flaps, like other tissue from other parts of the body, and also fill that whatever gap that we have removed, whatever area which we have removed in breast, that is called flap surgery. So that is also possible if we remove more breast. And it is also nowadays possible to reconstruct even the whole breast when we have removed for some patient when we are not able to conserve the breast. So now the science has so progressed, health science, so it is not required to remove, because it is psychologically and mentally so difficult for the patient to accept that their breast has been removed. And it is also important for them to give the self-esteem that and also they can lead a normal life when you compare to the other people around. And the other important thing the patients who ask me is the loss of hair when they go for chemotherapy. So this is a common question which I encounter, that whenever patient is taken chemotherapy, is there any loss of hair or something. So the most important thing we should know is, yes, in few of the regimens what we give in chemotherapy, the patients are going to lose hairs, but it is not permanent and they are going to get it back. But the most important thing here is to take the treatment. So it takes either 6 months to 1 year for the hairs to regrow. So that is an important message I want to give. For the reason that they are going to lose hair, they should not discontinue chemotherapy. So and the other important thing, I think already it has been discussed, like early detection with screening. All the women who are more than 40 years should undergo a mammogram. Between 40 to 50 in India, we recommend once in 2 years, every woman should undergo a mammogram as screening tool. Once in a year, the patient, the normal population, that is women, has to undergo a mammogram. So this is one important thing where we can detect breast cancer at an early stage. So there are other early health modifications, lifestyle modifications that we can do, so that we can reduce the risk of breast cancer, like doing regular exercise, at least 30 minutes a day, eating good eating habits, like eating vegetables, eating fruits where they have vitamin E, vitamin C, which also reduces breast cancer. And also, as already mentioned, at least once a year, all new they have to feed the breastfeeding should be continued once, at least 1 year they have to feed, not less than 1 year. If it is ideally, it should be for 2 years. And the other things like avoiding alcohol, avoiding cigarette smoking, all these are the risk factors that helps to reduce the breast cancer risk. So I think I have given my message. The most important thing is to detect the cancer early. Whenever somebody is having the symptoms like a lump in the breast or other early symptoms like a discharge or bloody discharge per nipple or retraction of the nipple or any strong family history or a mammogram detected have to consult a doctor as early as possible so that they can do the further investigations and also detect this breast cancer early, so we can reduce the mortality that is because of this breast cancer. Thank you very much.
Thank you, doctor.
Yeah.
What struck here with me is that doctor is meeting with the patients who are confirmed cases, of course, because he's a surgeon, meeting with patients who have to go through.
Correct.
Yet, he is so deeply aware of this level of anxiety that women go through with this idea of portion of their breast or total breast removal. It's an infected region. It's a disease that has attacked you, and you're going there for a treatment. And in case where a man was suffering from a certain disease, he wouldn't think as much as twice about getting that particular portion of his body removed, if that is what is going to save his life. But a woman, the entire uh, illusion of beauty and the standards that the women are forced into meeting, and this is exactly what Dr. Kamath also pointed out right in the beginning itself.
Yeah.
Lifestyle changes that we are continuously talking
Yeah,
about.
we should.
In fact, women, so, I mean, doctor, you're telling me that people would rather stop chemo than go through that entire process of targeting the disease and getting rid of it.
Yeah, that is what. See, the most important thing I already mentioned compared to other parts of the world, where in European countries or in USA, 70% of the patients, they undergo breast conservation surgery. But in India, 70% of surgeries, what we are doing are mastectomies. We are removing the whole breast. It is not because the doctors are doing more mastectomies. It is because the patients ask for more mastectomies. Because it is the general mentality of the people that if you remove the whole breast, it is more safer. That is not so. That is not so. So what we should spread our awareness is, the most important thing is it is possible to preserve the breast even with cancer. Even a cancerous patient can preserve breast. It is possible to reconstruct the whole breast even after removal of the whole breast. And the other thing is, as you mentioned, it is not important. It is important for the patient to continue chemotherapy to be alive, and then the whatever hair loss which is there, it is temporary. It is going to come back, and there are so many other options available even for the replacement. What do you lose hair at that time for that short period, which is less than 6 months to 1 year. So that is one important thing I think I have to stress on here.
Definitely. But I am still part of me, a big part of me, being a teacher who spends a lot of time on gender question in the history, etc. I am shocked at how even a medical emergency like a breast cancer would make women focus more on reaching the standards of beauty, of being in the league and being called beautiful or desirable by the men around them, maybe the husband, or the so-called the idea of normal, everything. So you would stop your chemo so that you don't lose your hair, or you're going to ask the doctor to, make your breast look okay again, right? Now, that is what I want to focus on in the next section. Recovery, experience of having gone through the diagnosis, having gone through an operation, and then recovery. All of this in itself is a huge mental challenge. Added to that is the burden out of women around us, the way they look, the way they should look. Yeah, and then this disease. So on that note, I want to bring on board Miss Hiba Siddiqui, and I want her to please talk to us about
Hi.
kind of mental challenges a woman goes through. I'm talking about a young, driven, vivacious career woman, hypothetically. And she's all of a sudden diagnosed with this complication. Hiba, let me know what that person, in terms of the level of anxiety, would go through the during the entire process, not just during the recovery here. The entire process, the level of and the variety of traumas that a person goes through. On that note, Hiba, if I can take a moment of your time, I would request all the speakers to please switch on your videos for once. I think my technical team wants to take a snapshot of the members attending the session. So please put on your videos for a moment so that the technical team can take a snapshot. On that note, Hiba, please enlighten us. I am very, very interested personally in getting to know of the mental pressures that a woman goes through.
Yes, thank you. Thank you, Namita, and thank you, Humanizing Lives, for, I think, having all of us over for such a comprehensive discussion. And I was hearing the previous two panelists as well. And I think the need to take care of your physical health. And for me, when you talk about the whole totality of what is health, I think everyone looks at cancer many times as merely a physical illness only. But what they forget is an equally integral aspect of the mental well-being, the social aspect, the emotional, spiritual aspect. And I think that's what I'm going to be talking about. An equally integral bridge between the physical and the mental aspect, which is what psycho-oncology does, and which is what I do at Max Institute of Cancer Care back in Delhi. Many times we've talked about, how it happens, what kind of changes do you feel physically, but the broader question comes in that how do I actually feel? And through my sessions, through my through my meetings with a lot of patients, uh, most of the common reactions that have come up are that, there's a sense of loss and loneliness that, it's just happening with me. Why me? There's also this collective sense of grief that I'm facing at multiple levels. I'm facing at a body level, I'm facing at an emotional level, I am facing at a level where I don't know what's happening to me and I don't know what all to grieve. Is it my independence? It is my change of routine, fear of the unknown. There are anxieties and panic-like situations, depressiveness and sadness, constant worry of what's going to happen. What does surgery mean? What does chemotherapy mean? What does radiation mean? And many times these reactions have impact at multiple levels. The first impact that we look at is a psychological impact, where we're looking at how my identity in relation to myself, my body, the image has suddenly changed over a period of like one surgery or 6 chemocycles or 2 chemocycles. I look different. Do I identify with this self of mine in the mirror? Many times, no. Many times people have very, very unpleasant adjectives that they use for themselves. I look horrible. I look like a monster. I look like a bad person. And those reactions, when in relation to the other, really gets impacted a lot. Many times there are mood swings, emotional outbursts, crying spells. Many times you have something which patients often joke with us called the chemo brain. Your memory gets impacted. You're not able to focus properly. You're not able to have decision making, which is precise. The behavioral aspect of the impact that we see is a lot of aggression and irritability. There are lots of temper tantrums, especially with a lot of women because their hormones are shifting because of the medication. Sometimes they don't want to comply with treatment. They don't want to go ahead with treatment. They start developing symptoms that something's wrong with my body. Some changes are happening with my body, and I'm pretty sure it's a complication. Do I have cancer again, and so on and so forth. Sometimes they don't want to come to the hospital because the hospitals bring in a bad memory. And what it does is that you feel very isolated. Sometimes there's stigma and labeling where, oh, this patient is diagnosed with cancer. And in psychology, we often say this thing that, don't stigmatize someone by labeling them saying cancer patient. You can also change your lingo and you can say a patient diagnosed with cancer, or an individual diagnosed with cancer, or an individual having anxiety, rather than saying that's an anxious guy. or an anxious girl. So maybe these are little changes we can take from our level to reduce social stigma and impact on a patient diagnosed with breast cancer. Now, an equally integral aspect of the illness is the impact on the caregiver and the caregivers or the family or the friends themselves. And a very underrated concept that we don't ever talk about because our entire focus is on the patient is the fatigue and burden that often families go through. There is a shift, evident shift in roles and responsibilities. The burden of care is very, very high. Sometimes you develop conflicts because the breadwinner of the family is the one on treatment, and suddenly everyone's on their own, not knowing what to do. Some people feel very guilty for being the healthy one, and the person, their loved one, is going through something so difficult in their phase of life. Of course, work-life balance, financial and economic stability also gets impacted. Now, my last section talks about what can we do? How do we cope and how do we deal with this? The first foremost thing is that it's important to realize that when we are diagnosed, we need to start preparing ourselves for a life transition. It's a chapter of your life, not the end. Don't look at it as a before and after event. You can look at it as a present in the here and now event that I have to take care of my body. My breast is unwell, that's an organ of my body. So you need to see how you are now. You've been coping with things differently, and now you're expected and required to be different, which is new, which might take time to transit, but it's something that helps us to prepare. It's important to look at this problem as an independent problem rather than pointing out everything going wrong in our life. That sometimes will overwhelm you, create a lot of chaos, not make you realize that it's one problem and that's my cancerous tumor. Do I have a lump? Do I have to go through surgery? Do I have to go through chemo? What is my plan of action? Let's look at one step at a time. My physical health, mental health, a holistic care approach. We need to also understand what matters. We can't look at everything. Maybe right now, I'm the one in focus. I matter. I need to understand, okay, in this moment, the next 6 months are going to be crucial. I don't need to know what people will say, what my boss will say, what my family will say, how much work am I doing, doesn't matter. The focus is you. Build social support. It always makes us feel we're not alone. The whole concept of a support group, we have a really amazing volunteer support program back in Max, and it's run by survivors and patients and volunteers who have been diagnosed or their families of people diagnosed, and it helps you connect to the other at a level which is so beautiful that you feel like a big large family, thinking that, okay, you know what, I'm not the only one. Be body positive. Breast cancers often make your body disfigured. Sometimes it changes the shape of your body. You lose a breast. For a woman to identify with that is and not be able to identify post surgery can be a very, very big psychological traumatic event. It's important to build awareness and understand what my needs and desires are. Important to celebrate all shapes and sizes. For the men whose spouses or sisters or mothers or children are going through this, please encourage body positivity and encourage fitness and acceptance at your level as well. It helps the other person feel less inhibited. Create meaningful moments where you're able to spend time, you're able to relax from work, you're able to focus on you finally. And those meaningful moments can be very nice. Connect to people, remember them, be around people who care. And you realize who your true family and friends are who really genuinely care. Something that works for me a lot is I just love to humor myself most of the times, but I also like humor in general. It's important to laugh. It's important to spread that joy. Even if you're going through the worst cases or sometimes your family is going through bad times, don't be guilty of smiling and just watching a funny video, laughing, going out, taking a little breather from the hectic routine. Focus on small things rather than obsessing over being too happy and positive all the time. Otherwise, I'm such a quote unquote weak person. Maintain a daily diary. You're in the process of creating history in a way for your future generations. Practice a journal diary where you can write gratitude, where you can thank things that have been going well in your life and not just the cancer, which has created a little bit of a vacuum in your life. Praise and feedback and give feedback to people who are caring for you. Give that feedback and admiration to yourself. Acknowledge yourself. You can write a self-esteem journal where you can write a Monday, Tuesday, I did something good today. I feel good about this particular thing today. Have achieved this today. I overcame another chemo cycle. Look to the past and remind yourself how resilient you are. You have the mechanisms. Tell yourself that I've survived one cycle, of course I can survive six. I've survived surgery, of course I'm stronger than this. Remind yourself that you're all super women and super men in your own ways. Lifestyle is a focus which everyone will narrow their talks on. It's important to keep yourself hydrated, eaten well, slept well, no smoking alcohol because it clashes with your chemotherapy and surgical post-op recovery. Have a lot of fluids, go out, walk, yoga, mindfulness, anything that works for you. Everything's online now. And lastly, it's important to be kind to you, because if you're not kind to yourself, it will be difficult for you to be kind to the other. So be less harsh in how you look. You're beautiful, just smile. That's all I feel. You don't have to dress up. You don't have to do anything. Just smile. Promise you, it'll be the best selfie of your life. And lastly, if you feel the symptoms are very overwhelming, please reach out for professional help. Psychologist or psychiatrist, they give medicines. Psychologists are trained to provide therapy. It's through talking most of the times. There are other modalities of art, movement, etc. So please reach out. Normalize help-seeking behavior. You are not alone. We have to go for our own therapy. So honestly, this is as normalized as it can get. So thank you so much. And most importantly, celebrate your success. Celebrate every cycle, celebrate every person who's involved, celebrate every little step. Don't wait कि मेरा जब सारा treatment खत्म हो जाएगा, then I'll enjoy. Celebrate every moment. I'm done with surgery, celebration. I'm done with chemo 1, chemo 2, chemo 3, radiation 1, 2, 5, 35, whatever numbers that you have, and then enjoy. And celebrate yourself, be body positive. So thank you so much.
Thank you, Ms. Subha. That was an amazing presentation.
Thank you.
Thank you so much. Like I said, please keep writing your questions in the chat box. We will take it up once the sessions are over. On that note, was it body positivity, cancer or no cancer? I think a major portion of women have been battling with that idea of impressing this invisible crowd of people based on the idea of perfect body image. As much as it changes with age and time, it was of a one kind of a body that was celebrated in the 70s, and then another kind in the 80s, and then another kind in the 90s, and now here we are, right? And in order to bring your body in shape, in order to match the standards that the world has set up for you, you play around with your food. You abuse yourself a lot of times by not taking that food intake that is necessary. And then sometimes when you're emotionally grieving, you tend to overeat all kinds of carbs and sugar and your coke and your liquor. All of that put together is an expertise that lies with our next expert, Dr. Aruna Malya. I welcome you aboard, ma'am. Thank you so much for giving us your time. We appreciate the fact that you graciously accepted our offer to do this session with us. Let me introduce the doctor to you in a very, very short lines here. Doctor has an experience of about 16 years. She's a senior dietitian at Manipal Healthcare. She also specializes in applied nutrition and dietetics, if I'm right in pronouncing that. She's a lifetime member of Indian Dietitian Association, and she has published over 100 articles. So she knows her food, and she definitely knows your. We are going to be keeping this discussion restricted to how to avoid any kind of cancerous growths by good healthy eating. But please, doctor, feel free to talk about wider effect and impact of the food intake amongst people. She's a very, very good speaker. She's attended many webinars during this short period of lockdown that we've all experienced. Ma'am, with that, I would please invite you to start your session, and let's see what's there for us to eat and not to eat.
Good evening, everyone. Coming to the diet, we don't know what is the cause for cancer. That is still a question mark. But we see that a lot of reasons contribute to cancer. We say heavily smoked, pickled or salt cured food also has some carcinogens. Alcohol associated with cancer. Then we have beverages like wine, brandy, etc. That also during fermentation there, it causes
I think we are facing a technical issue here at the speaker's end, or is it only for me? Is it my network? Somebody please confirm.
Yeah, it's a technical issue, I guess. Her network is not working well.
So please bear with us. We will wait for her to come back. Yeah, in the meantime, I would request everybody to please throw in your questions so that we have nice list of questions that we can, bring forward to the speakers.
Hello, can you hear me now?
Yeah, we can hear you.
Vibhu, can we move on to the slides, the third slide?
Yeah, ma'am, I'm just trying it. I'm not able to share the slides, I guess.
Okay, I'll just keep talking. You can try.
Yeah, I'm
So
fixing it. Just give me a minute.
we feel that evidences of high intake of calories also have increased risk for some cancers. Evidences of high protein food also has led to cancer, and high fat intake, especially when you put on a lot of weight. Obesity also has increased risk of breast cancer and colon cancer. And of course, as Hiba told, stress also contributes to cancer. And some cancers are genetic, like colon and breast cancer. So coming to the breast cancer, if you have to, I have to throw light on just the breast cancer, it is just excess of energy, alcohol, and saturated fat. Saturated fat consists of all these hardened fat like butter, palm oil, ghee, and which hardens at room temperature. And the trans fat, which we have it in the cooked food articles, which gives us the taste or pleasure of having. This has added to all the cancer factors. And other factor could be pregnancy and late pregnancy and menopause. Main reason for this is lack of vegetables and fruits in the diet. There's no fiber in the diet. Vitamin C is not there. Then the shortfall of keratin in the diet causes breast cancer. So along with the chemotherapy and radiation, there are a lot of side effects, like there is severe vomiting, diarrhea is there, lack of appetite, you have a metallic taste where you don't have an appetite to eat. And because of this, the energy expenditure goes on and there is a progressive weight loss. And undernutrition. Because of this undernutrition, impaired food intake, there is malnutrition also, and malabsorption of various nutrients, which causes some deficiency. Along with vomiting and diarrhea, we see that there is a fluid and electrolyte imbalance, especially the sodium, potassium. And as such, we see as the cancer patient moves on to various modalities of treatment like radiotherapy, chemotherapy, there is cachexia, where there is weight loss, severe weight loss, anemia, that is hemoglobin goes down, and symptoms which impairs food intake. So let's go on to the general guidelines. General guidelines would be, it consists of whole grains, fruits, vegetables, healthy fats, and lean sources of protein. Can we move on to the next slide, please? So the tips what I would like to give you is, fill your plate with fruits and leafy vegetables. Let it be wholesome. When you see the plate, you should feel like you should have it. So try to keep all these fruits, leafy vegetables, 3/4 of your plate, and reduce the content of carbohydrates. When it comes to carbohydrate, take more of whole grains. That is whole, it can be whole wheat, it can be your simple ragi or jowar or bajra rotis or anything like that. Then it can be beans and legumes also, which has more of fiber in it. These fiber will keep you full for a long time. So your appetite reduces. At the same time, it helps you to maintain the weight. And reduce the intake of processed food, which is processed, packed, and which has a lot of salt in it. And try to use more of organic food where chemicals are less. And also you need to concentrate on calcium-rich food, which are mainly green leafy vegetables and milk products. Yes, Vibhu, can we move on to the next slide, please? So as I told you, the complex carbohydrates are rich in fiber. It helps you in weight loss, which is very essential when it is coming to preventing yourself from getting cancer. Main thing is you need to control your weight. So added weight will lead on to many of the health ailments. So controlling your weight comes as the priority here. And the fiber-rich food as such, as I told you, it keeps you full for longer time. It gives you long-lasting energy. So we have given some examples like whole wheat, millets is nothing but ragi and all those things. And quinoa is one thing which has now been introduced in the market, which you can have. Beans and legumes as such has been a staple diet of Indian foods, like everywhere. Dal is common, whether it is North India or South India, anywhere. Fruits and vegetables, try to have seasonal fruits and vegetables at least, and try to have more of baked potato, which we call it as jacket potato with the skin. And we get whole wheat pastas now available. Even kids would love having those. So try, we always say we educate a lady in the house more than the other people, because lady of the house cooks good delicious food for the whole family, and she keeps the whole entire family healthy. So the more education is given to the ladies, that family is always healthy. That is what we feel. So try to involve more of, include more of brown rice. It can be red rice also, which is available in Karnataka here. Oatmeal, of course, most of you are familiar with that. Whole grain bread and bananas. Yes, Vibhu, can we move to the next slide, please? So don't overload yourself with proteins. We say protein intake is necessary. How much protein? It is 1 gram per your kg body weight. Suppose you are 60 kgs, you need to take 60 grams. Because we say take more good protein, don't eat extra protein, because it is going to burden the kidneys, as well as extra protein is injurious, especially for ladies, because as they move on to the menopause, there is calcium loss also. So this extra eating more protein will cause calcium losses also, but it also decreases the bone density and leads to osteoporosis, which we all know as ladies move towards menopause, and during 40s, 50s and all, generally they tend to have knee joint pain and all. There is a chance of osteoporosis. So you need to include proteins as well as calcium here. So include milk, egg, marine foods and poultry. That is what we call it as high biological value protein. Yes, next slide, please. So when coming to the fats, we have healthy fats. What are healthy fats? Healthy fats are fats which are generally liquid at room temperature. That is what we call healthy fats. It can be olive oil, it can be sunflower, it can be canola, it can be safflower. There are a lot of oils available, like rice bran, everything. And you need to take oil, but how much is a question mark. We say take oil. It doesn't mean that you need to fry everything in oil and take it. It's just for a tempering or just to enhance the taste, because oil is required for the absorption of a lot of vitamins like vitamin A, D, E, etc. So try to take this. And fats also come from the nuts, what we take. It can be walnut, it can be badam, simple as badam, flaxseed, you get sunflower seeds, you get walnuts. You can take any of those also. Snacking, we always tell, don't keep eating carbohydrate throughout the day. Maybe at 10 o'clock or something, you can have a handful of dry fruits. That adds to the fats here. That is called healthy fats. So try to avoid lot of red meat in the diet and pure ghee and lard, that is the pork fat, etc. Try to have slim portion of the meat and try to include oil, and especially these avocados are rich in good fats, which you can always use it in your salads or in some dressings or something. So use it. We say minimum of 3 teaspoons, maximum of 4 teaspoons can be used in a day. Yes, Vibhu? While coming to the minerals and vitamins, we have a lot of iron-rich foods, which is essential to increase the hemoglobin. So we have the lean red meat here. Lean red meat is the fat portion should be less in the meat. That portion can be used. We have the dark poultries, lentils. Lentils is nothing but the dal and pulses, which we used to take before, which is now called as lentils. Palak, simple, which is available in different forms. Almonds. And we have, now we get all breakfast cereals which are enriched with iron, fortified with iron, which also can be had. As I told you, try to include fresh fruits and vegetables. Try to eat it with the skin, like carrots and all. You need not peel it. You can just wash it properly and you can use it. Don't peel everything, so that all the contents which are, the nutrients which are in the skin is thrown out. So try to eat vegetables which you can eat with the skin. So edible peels, soya bean, you can you have it in the form of soya granules, you can have it in the form of chunks, or the soya beans in the gravies. And our Indian condiments as such, like turmeric and garlic, ginger, which we use daily, can also be included in more amount. And also the green tea, which is now very trending for weight loss, that also can be had. Next slide, please. So don't forget that you need fluid for digestion of everything. So try to take adequate fluid intake. So dishes which has more of moisture can be had along with beverages. But remember that you need to cut down on alcohol and caffeine. Caffeine is tea or coffee, anything more than 2 cups a day is a no, always a no. So if you are having alcohol, maybe it's not that you should have. If you are having, cut it down to 2 drinks a day. And see that, because this caffeine also interferes with hormone level and increases the loss of calcium. So keep it under restriction. Avoid drinking more than 2 cups and limit alcohol to 150 ml per day. Yes, Vibhu, can we move on to the next slides? So tips what I want to give you is, eat at regular intervals. Don't keep a long gap between the meals. In that case, what happens is, when you keep a long gap, you tend to eat more. So try to eat small frequent meals, eat at regular interval, have a good breakfast, followed by a snack, a light snack, a proper lunch, and a tea light snack in the evening, maybe some biscuits or something, and have a early dinner as far as possible, so that food is digested before you sleep. Yes, Vibhu, can we move on to the next slide, please? Cut down on the junk food. Try to have lot of complex carbohydrate which will keep you full, instead of having all the junk foods which I have shown in the pictures, like chaklis, murkus, and the fried items. So what happens is, when you start eating this, you get tempted more. Until your stomach fills, you just keep on eating. And what you do is, you cut down on the carbohydrates or the next meal. So don't do that. Cut down on this, because we are looking for better health and better tomorrow. Next slide, please. So the last, but the tips what I want to give you is, to remain healthy is, eat small frequent meals, add fiber rich diet. It can be in the form of salads, it can be in the form of dry vegetables. Try to include at least 2 to 3 vegetable serving in a day. Cut down on lean meat. Eat egg whites more than the yolk. Yolk has more of cholesterol, which again leads to health ailments. So use skim milk. Try to remove the fat from the milk and use it. Eat more servings of vegetable and fruit. If you can eat 3, it is good. If you can eat more than 3, it is very good. So eat at least 3 servings of green leafy vegetable. It can be palak, it can be methi, it can be radish leaves. It can be any green leafy vegetable, including your coriander leaves or drumstick leaves or whatever is available in your garden too, and which is edible. and drink enough of water, use healthy fats, use less oil in cooking, try alternate ways of cooking food other than putting too much of oil. It can be roasting, it can be grilling, it can be steaming, it can be boiling. You can use all those methods of cooking. And last but least, exercise. Exercise regularly. We say that at least 20 minutes, 5 days a week, otherwise at least 40 minutes, 3 to 4 days a week, plus 1 day of intensive activity is a must to keep yourself healthy. Thank you.
Thank you so much, ma'am. This was interesting. A lot of things the so-called urban cool lifestyle has already brought into people's life, whether it's green leaves or quinoa that you mentioned, avocado, all of those things. The house is open for questions here. To direct my questions specifically to doctors, I would like to welcome Dr. Kamath. My first question is to her. Ma'am, I would want to start with the myths attached to cancer. There are a lot of things that, okay, so we increasingly so are finding patients around us, especially breast cancer patients around us, more in numbers than we once did. And it could be a lifestyle changes that is, making them more susceptible to diseases like that is something that we've already established. But ma'am, there are also very popular myths that are very outspokenly kind of brought onto the fore by various non-official conversations that go on around us. For example, wired bra, deodorant, has been accused of increasing the chances of cancer in women. Does that have any valid medical point attached to it or not?
Yeah, this is a very common rumor that has been going on in the internet regarding the underwire bras, whether they do cause cancers. So a lot of research has been done and we do not have enough evidence. But in 2014, around 1,500 women were involved in this study, and they did not find any association of cancer in women who were using underwire bras. So that is why it is, we always tell our patients to use, a good sized, a good fitting bra, which they can use. And especially in the night, if they're not comfortable, they can not use it. But there is no evidence to show that underwire bras do cause cancer or even wearing bras.
Oh, perfect. So the size needs to be appropriate for your comfort and for allowing the breathing, I believe, to happen.
Yes.
Lovely.
Two types of bras can cause skin irritation and it can be more uncomfortable, and also it can peel off the skin. So that is why we advise them to use a good fitted bra, but it doesn't really cause cancer. There's no evidence as of now to say.
Ma'am, on one hand, this is something that has already been popularized, that if you have children in the right age, you would be less at risk of breast cancer, particularly so. But ma'am, what happens if you do not have kids at all? Does that bring you more in line of having the cancer possibilities or no?
See, now when we are talking about breast cancer, it is on. We are talking about the risk factors. It is not that any women who does not have kids will definitely get breast cancer. Even by being really fit and healthy, sometimes they could be, they could get breast cancer. So it is not that. But yes, there is a slightly higher risk. Suppose it is combined risk. Somebody is obese, not having a family, and smokes or drinks and has a very sedentary lifestyle. Now, so many risk factors together, yes, these individuals are more prone to develop, breast cancer or any other such cancers. But ideally, only one risk factor, yes, there are at a slightly higher risk, but it is not that, nulliparous women will develop breast cancer, but they are at a higher risk. Having, nulliparity, that is not having kids, or not breastfeeding, having very early menarche and late menopause, being obese, all these add on to the risk factors.
Okay, beautiful. Thank you, ma'am. That brings us to our next question. Is that somebody who already has a symptomatic gynae experience, should they be more kind of on alert as far as breast cancer is concerned? Let's say PCOS or any other factor, any other gynecological complication has direct relationship with breast cancer, or no? It's independent.
PCOS has more associations with uterine cancer. There's a threefold chance, high risk of them developing uterine cancer. But breast cancer, most of the times, is there is a hereditary, which I just told, BRCA1 and BRCA2 gene mutation, and chronic exposure to estrogen and progesterone, like use of oral contraceptive pills or hormone replacement therapy, or IVF treatments, like infertility treatment for long period of times. All this puts them at a risk. And then the hereditary abnormal gene that I was talking about, more prone for, and also certain inherent breast cancer, certain breast lesions which are actually not cancerous, but they can turn into malignancies. So there are certain breast lesions like that, and also radiation to the chest as a young adult or as a girl for some other cancers, like say Hodgkin's lymphoma. They are also more prone to develop breast cancer.
There is another condition which young girls usually, get very scared of when they find a lump-like formation, fibrosis, if I'm not wrong. It's painful, etc. Somebody who has a tendency of developing fibrosis, are they more prone to breast cancer, or are these two developments completely independent of each other?
No, yeah, no. Fibrocystic disease, as you what you meant was they'll have painful breast, especially prior to the periods. They are because of the hormonal changes, so they do not cause any breast cancer. And lifestyle modification is the key in these women, in these young girls, and a little bit of vitamin supplementation would do a lot in reducing the fibrocystic disease. It's more because of the hormonal problem, and it doesn't lead to cancer. So they can be rest assured.
That's a question coming from the students of the college going age. So I thought I'll direct it to you directly. You're an authority on that. Then my next question goes to Hiba. Hiba, we talked about the generic stress, the generic self-confidence question that a patient starts dealing with. What I really want to know here is, it's easier said than done when you say, motivate yourself. I think it's a teamwork, right? In that, are there also certain not full-blown therapies, but certain exercises that a breast cancer patient can independently go through or do at a home space and kind of start feeling better immediately? Some meditation maybe, or are there low physically taxing sort of exercises that one could do? Is there something that you all would suggest a generic breast cancer patient who's just gone through the chemo or is in the radiation stage?
I think it's important to, I think I'll probably talk about the mental exercises. Of course, the physicality bit is important itself, but you have to take care of the arm, the surgical arm, so that you don't put your weight on the side, the side of the surgical side side. So you have to be careful what kind of exercises, which I think the physiotherapists and other yoga instructors who are equipped to handle such individuals will be able to guide. However, once you come back home, I think it's very, very important to normalize your routine. Very soon after the surgery takes one day, you're usually home in 24 hours, and obviously the post-op care happens. But what you can do is you're walking. So nothing's wrong below, right? So you can increase your walking, you can have brisk walking, you can climb stairs. All of those things are not going to harm you. The second thing is that you can try to reach out to people, try not being isolated, try not being alone, try communicating how you're feeling in the moment, let your family and friends in, as comfortable as your space can be. Maintain a diary, maintain a gratitude journal, because you're also feeling very different after the surgery. You might develop disfigurement issues. You might look at yourself in the mirror, which in itself is a big exercise to how to see myself for the first time with a very different body. So I think it's also important for us to work with not just patients, but their families, to orient them to transit in this change. And yeah, dance, songs, everything works, art works. Don't listen to sad songs when you're sad. That's our tendency. Listen to happier songs because the lyrics stay in your mind and then triggers a bad reaction. So
Right.
always remember, when you're sad or you've broken up or you're, undergoing heartbreaks and stuff, don't listen to sad songs.
Right.
So yeah,
Oh,
it's
lovely.
something one
I
can
think
do.
people mostly end up doing that, listen
Yes,
to
yes.
story songs, etc. Uh, yeah, thank you, Hiba. Dr. Harish, that the whole question of surgery in itself is so scary to individuals. I mean, disease or no disease, the fact that somebody has to go through surgery is so scary. Uh, now, when I'm talking about a surgery that has just taken place, right? A surgery that is too fresh in the memory, more than the physicality of things, the memory itself. Do patients like these also suffer from post trauma stress? Do they? Iba.
Oh, sorry, I thought that was directed to Dr. Harish.
Sorry, no. So I started out with the surgery aspect, but the question is, do patients like these also suffer from PTSD?
So PTSD is a broad clinical term. If it fits in the clinical criteria, of course, this is a traumatic event. So if people are more distressed, the severity of the distress is there, they're having clinical symptoms which are impacting or developing psychiatric disorders, then of course that counts as that. Uh, Independently, it is a traumatic event. Some people are better adjusted than the others. It has nothing to do with how resilient you are and I'm not, or vice versa. I don't like using the words weak and strong. That's just a fundamental thing I fight with my patients. Don't use them. But it is traumatic. It is shocking. It's a change which you've not welcomed. It's a change which I've not chosen. It's not like I bought a new outfit and I'm suddenly very excited to wear it. I'm changing my entire style. I'm changing my entire wardrobe. I'm adjusting to a new me, to even touch myself while showering, or to feel a change in this body change that has happened with my breast not there, or lumpectomy reducing the size and so on, can be very jarring. So the trauma has to be dealt with a lot of affection, with a lot of gentleness, with a lot of routine mental health checkups uh, for the individual and their family, especially partners, if that are there. Sometimes for the kids, it's difficult to watch their mothers suddenly look different, either flat chested, or if they're also undergoing chemotherapy and then there's a surgery, then you have no hair. So to look at yourself in without a breast and no hair, no eyebrows, no lashes, can be very difficult for you to even identify with who I am. So definitely have a mental health care expert at all times when you're part of the larger care, pre-op and post-op.
A lot of famous personalities have gone through this experience. Of, uh, a few that I remember on fingertips is, I think Lisa Ray went through this, Sonali Bendre went through this, Manisha Koirala, if I'm not wrong, was that also?
Yes.
Yeah, right. So all of these people who went through it have increasingly so talked about willpower. I want you to please explain to us, on one hand, the dependence and the understanding that if a certain kind of chemical composition is given to you, and it is going to have a biological effect, what irrespective of how you're feeling, should not have an impact on your body, right? Because chemically and biologically, your physiological aspect is taken care of. But the more interviews I see, the more importance of willpower, the will to live, the will to win, or the will to be able to make it out of this as a whole person has been emphasized on. I would want you to please elaborate on that for the viewers who will be listening to this.
I think willpower and I think the whole concept of how strong and weak I am is also very, very pressurizing for anyone undergoing an illness to be having a performance anxiety, if I could probably say that, while you're actually taking care of yourself and you're in a process of healing and care. It's also important to realize that breaking down, being emotionally sensitive, crying spells, anger outbursts is not a sign of weakness. It's an emotional expression. It's okay if you've never cried in your life, but today is the day that you cry. It's absolutely fine. It's important for people to also say that, hey, you're feeling bad today, and that's okay. It doesn't make you a weak person. But the pressure to be this really happy, overtly positive person, people end up obsessing over it and stigmatizing their own emotional reactions, which they term as negative reactions. Crying is not a negative reaction. I cry when I'm angry. So, so those are things that we need to imbibe. People also need to be told, especially with these celebrities. The good thing is that when they talk about an illness which can be relatable, you can understand and empathize that, you know what, anyone can get that. The way these women have been advocates to this illness for themselves, I think it's been really beautifully handled. They talked about the very real aspects. They didn't have to bring in aspects around just look at me, but we dealt with it in a way. They were as humanly connecting to the other person as anyone else. If they had hair loss, they're like, this has been a difficult experience because vanity was very important, not because they're just celebrities, but they're also women. If you have a bad haircut, आपका mood खराब हो जाता है for the next 1 week. Imagine just not having hair, which, you know, there are ladies who've grown their hair very long all their life, and suddenly now they're in short hair or, you know, blunt cut and so on, and they're not okay with it. So it's okay to tell them that it's fine. If you're not feeling the best of yourself all the time, you don't have to perform for anyone but yourself. So be you and be unapologetically you.
Lovely. Thank you, Hiba. Dr. Harish, since I started out with surgery with Hiba, I am all the more interested in getting your feedback. Do we have Dr. Harish here? Dhruv, can you hear me? Okay. So in the meanwhile, while Dr. Harish comes back to the session, Dr. Aruna Malya. Ma'am, food is interesting. Food is interesting here. But ma'am, all these food choices that you're talking about, whether it's quinoa, whether it's avocado, I mean, these are the things that caught my fascination. Canola oil or olive oil. All of these are very rich choices to make. These are expensive things that we are talking about. Jowar, bajra, yes, these are two options that you gave us. What other everyday choices of food can we make in order to avoid when you're talking about fruits, the inclusion of fiber and salads into the meal, and you're talking about eating in shorter durations, in smaller portions, is what you said. Yeah.
If you are going to eat what you get.
Right. So my question here is that while you are talking about the way one needs to eat and all that, one needs to kind of bring in their life as a, you know, everyday consumption pattern. What I want to know here is, you know, as far as diet is concerned, a similar philosophy is also kind of talked about with the people who are into bodybuilding, etc. But at the same time, they're also given a large amount of protein for everyday intake for the muscular development, etc. That impacts the onset of breast cancer, is what you said. How dangerous is that for the protein growers?
it is a different aspect. Suppose you are into weightlifting, you are eating more protein, you are burning it too, doing exercise. But suppose you are not exercising, you are just, because for the sake of eating protein, you go on eating protein, and if your kidney is not able to take the burden, then of course, all the kidney parameters will go up. And also the protein, when you take more of protein, there is constipation too. You need to equally drink in or hydrate yourself. So we say that proteins also is available in cereals and all. The common cereals, what we eat as rice, wheat, everything, a small portion of protein is available in that too. So what we suggest is eat high biological value protein that comes from fish, egg whites, the dal, the lentils, pulses, all these can be added in the diet. Suppose you are into muscle building, then of course, eggs is what we suggest, the egg whites we suggest, then of course the lean portion of the chicken, but we never suggest red meat. Red meat is the culprit there.
Okay, ma'am. Another thing which is a very ongoing thing right now is intermittent fasting. While you're talking not going hungry for a long period of time, this kind of dieting pattern actually asks people to go hungry for a long period of time and then eat a small portion of food or whatever. Can you please tell us about how dangerous that could be, not only for breast cancer but generally? The kind of balance that you're supposed to maintain, vitamin wise, calorie wise, etc. How does that imbalance or balance that out?
We have seen evidences that intermittent fasting helps in weight loss. We have seen our own fellow mates following it and losing a lot of weight. But what we suggest is losing a lot of weight within a short span of time is dangerous. And we have seen people who have lost weight have come and got admitted with us with COVID also, because you see that you are into deficiency of so many things. You don't have the stamina or you don't have that antibodies to protect yourself. That is a real experience what we have seen. But of course, yes, intermittent fasting has given a lot of results to obese people, especially who we generally differentiate people. Like, suppose if it is me and you, if we have to lose weight, we are healthy, we can go at just 100 grams a day, which makes 3 kgs, up to 3 to 5 kgs a month, because a lot of water is available in the body, it drains off, it dehydrates, so you lose more. As you go on through the months, weight loss will reach a plateau, then you don't lose weight. So now what these people who are very obese, they think that losing weight will help. Of course it will help, but don't go for a crash diet. You try to balance it. What generally these intermittent fasting people do is they eat at 8 o'clock, some 2-3 egg whites, finish. Whole day they drink hot water or the plain water. Towards the end of the day, maybe at 8 o'clock or 7 o'clock, they eat some vegetables, just the vegetables and a katori of dal. So this is not going to balance the diet. Balanced diet is what we generally say is very good for weight loss. Balanced diet should have carbohydrates, should have proteins, should have oil, should have vitamins, should have minerals and everything. So that will generally help you as you go through your life. This intermittent fasting is just for people who want to lose within few days. Some girls come to us and tell, ma'am, before my marriage, I want to lose weight. So what we tell is, health-wise, it is not it. Then what they do is they go back and follow what they were before. So I always suggest is go for a healthy balanced diet. You should be eating everything. At the same time, you should be losing weight. The formula is eat calories, burn calories. You can keep a deficient, you can reduce 500 calories a day, which will give you 3 kgs weight loss in a month. Don't go for a drastic weight loss where you will not be able to maintain it over a period of time. See that if you're able to maintain a weight for about a year, then the chances of regain is less. So in these intermittent fasting people, generally what happens is they just follow the diet for a few days, then they bounce back to the old diet. So what is the loss? Loss is you're losing on a lot of minerals and vitamins. You'll end up with some deficiencies. Your immunity is less. You'll fall sick again and every now and then. and concentration is less. You get angry very soon. Especially men who are on intermittent fasting, we have seen that they get angry very soon. If carbohydrates are not there, you can't concentrate in the diet. You need carbohydrates. But some people really follow it and they see that they have results, and there are evidences that intermittent fasting helps in weight loss. So it's your choice of diet you want to follow. But as a dietitian being in a health field, I always suggest a balanced diet with some exercise, lose minimum weight, that is 3 kgs, maximum of 5 kgs a month, maintain that weight for a period of 1 year, be healthy. That is what we suggest.
Lovely. Ma'am, there's this new surge in the accessibility, right, of this kind of knowledge. Sometimes it's half-baked as well. There are a lot of softwares out there that, don't give you the full information. They maybe give a synoptic view into what that particular dieting is and stuff. And they ask you for money when you want to have an extensive expert's opinion, etc. What would you like to tell those people who want to use the free half information given on the websites and not take professional help when they are dieting?
We see that whenever we meet patients or we meet some clients, they tell, this is there in Google, this has told that it will help weight loss. But does Google help you to lose weight? No. Isn't it? Does the Google help you to treat the ailment? No. That is why we are there to help. We know the fundamentals of food. What does food contain? What does any vegetable contain? What does a mineral, a vegetable or a fruit contain? How much calories are there in each item what you consume? So going for a freebies like this, of course, may not lead you somewhere, but you may end up with a crash, losing weight in a wrong way.
Thank you so much, ma'am. On that note, we missed out on Dr. Harish by minutes, if not more. He had a patient waiting. When do these doctors rest? Like, I'm always curious. So anyway, so thank you, Dr. Harish, for taking our time and attending the session. Nonetheless, we had a lot of questions. We could not put it across to you, but we'll do another session. We'll be more detailed maybe on that account. My apologies to the audiences who were looking forward with their questions to Dr. Harish. He got busy, profession calls, duty calls. On that note, to the other speakers, Dr. Kamat, Dr. Malya, Ms. Siddiqui, thank you so much for being with us here. At least I am going home far more informed. And like I said, we will be putting your entire webinar onto our YouTube channel. I hope we have your consent from all of you guys. And we have been running live on Facebook as well. So thank you so much for being here with us. It was definitely, with slight bit of technical glitches, a beautiful session. Thank you so much for putting in so much of effort and information together for the benefit of our audiences. Humanizing Lives feels indebted to you all for sharing the knowledge. Your mic.
Thank you, Namita. You were a great moderator. Just in everything. So thank you for having me and the other panelists. I'm sure would speak, but thank you, Ekta. Thank you, Namita. It was a pleasure.
You, Dr. Vidyashri, before you go, we would like you to come on camera and just say a quick bye to us all. Dr. Malya, thank you so much for coming, and thank you so much.
Thank you, Namita. Thank you, Namita. Thank you, Hiba, for the valuable information. And Ekta, of course, thanks a lot. And thank you, Vibhu, also for a grateful job. Of course, last minute, great help from you, Vibhu. Thank you, Dr. Harish. And thank you, Dr. Vidyashri. Thank you. A big thanks from KMC Group. Thank you, Namita.
Thank you, ma'am. A very, 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 very huge thank you to KMC for organizing all of this for us. My technical team, the founder, Ekta, everybody here who made this day possible. A huge thank you and this deeply felt gratitude from all of us to you guys. I think Dr. Vidyashree is also gone. Busy day, like I said, huge respect to the doctors for all they are doing in these days. I would have loved to have a longer question answer session, but I think I've taken a lot of your time already. So on that note, keep smiling bright and wide. And if you can't do that, get in touch with Humanizing Lives.
Thank you.
हाँ जी
Nice.